Good evening. Welcome to Lifestyle with Dr. Moby, and this is Dr. Moby. Today we're going to have a program about one of the big problems here, which is smoking. So, give you some figures. 34 million are smokers, current smokers in US. 34 million is a big number, out of which 16 million have some health problems with it. Still remains the highest in 25 to 64 age range, and pretty high in Midwest and southern states, and it's also prevalent everywhere else. So we're gonna talk with one of internists and board certified in geriatric medicine and internal medicine, Dr. Jamil Ahmed. Dr. Jamil Ahmed, we welcome you to our program. Tell us about yourself a little bit.
I'm a geriatrician and also the internist, and a big portion of my patients are age over 18, and they have varied problems, and some of the problems that you can solve, and something you have to control. And I would like to talk about the smoking because it has affected population of the United States and around the world more than anything else in the world.
So that's for audience. Then we're gonna talk a little bit about 34 million are, as we talk. So this is a big epidemic, we'll say, or pandemic, whatever you want to call. So it's a big problem. Let's talk a little bit more about and dissect this problem and address how to fix it. So we're going to talk to audience and educate them about smoking. So go ahead and tell me a little bit about some of the tobacco issues which you see usually in your practice.
United States government has focused this as a problem that needs to be tackled. And every 10 years, we have a program which is by Department of Health and Human Services. They call Healthy People 2020. It was set in 2010. So in 2020, we need to revisit what we have achieved in last 10 years. The goal of the project was to live us longer and promote a good health and are changing our behaviors. We have succeeded in some of these projects. Into that project, there's other disease was included, like a cancer screening, like a colon cancer screening, which is successful. You have give a reproductive care, then immunization of the people to help with sickness that can be preventable, hypertension, controlling diabetes mellitus and complication, decreasing the alcohol use, and tremendous effect that has in our society, and also promoting exercise. Tobacco smoking is also one of the things that we have to tackle. To talk about some data that how prevalent it is in the United States. Smoking causes ever close to 500,000 people death. Actually, it's 480,000 people. That is more than total death from HIV, drug use, alcohol use, motor vehicle accident, and all the arms and firearm-related death. Good thing happened that death rate has increased in last 50 years, but now showing some decline. And if you consider the total death from the cancer, 90% are related with smoking.
So that's a big number. So 90%. Now we'll probably educate a little bit about what cancers do you think are more in practice we see are related to smoking, or is it all cancer all over?
No, there is anytime you come to the point whether what kind of cancer, lung cancer is one that comes to our mind.
Yeah.
But some other cancer that goes with it, a lot of GI cancer like throat cancer, stomach cancer, pancreatic cancer, and urinary cancer like bladder cancer, and one blood cancer called AML is a kind of leukemia that's also been related with smoking. That is cancer. But as we know that we all think about coronary artery disease or having an MI or having a stroke, it is almost 2 to 4 times in people who smoke. So it is very, very prevalent and a devastation cause. And you see, I told you that the more death in smoking-related cause than anything else.
That's it. And that is sad affairs that despite with physicians telling all patients that smoking is the major cause of a lot of medical issues, still our patients are smoking. And it's unfortunate, but a lot of my doctor colleagues and medical profession, they're also smoking. So knowing them that, and they also know these are the risks. So we have to probably try to figure out what really goes with smoking that it's so addictive that it's hard to give up.
There is 2 things. One is in nature and nurture.
Oh, nature.
And you were born with these genes.
Okay.
For some people, actually, there's 3 places in the brain that can make you smoke more. People who have a psychiatric illness tends to smoke more, and especially schizophrenia. And if you have a smoke, you are a smoker and also a psychiatric illness, you tend to die almost 28 earlier than other people of the same age.
Wow.
So it is a very, very dangerous disease that we think of nothing about and smoke every day. And if you stop smoking today, you can probably prevent 1 death out of 3.
Wow, that's amazing.
And that it is better than any other disease, any other medication that will do.
Yep.
And if you smoke, you are more likely to have diabetes.
So, wow.
And you also have an osteoporosis, or like a bone gets thinned out, or rheumatoid arthritis, also more prevalent in the diabetics. So it is very important that we think seriously about smoking. Good news.
Good.
So we
always want good news. Let's give good news.
So between 2008 and 2017, there is a drop of smoking.
Oh, great.
United States. From 20.8%, it went to 14.1%. Our goal was 12%, but we didn't reach that. But we made very close. And if you think that who smokes more, immigrants coming to United States has one of the lowest rate of smoking.
Oh, great thing.
And Asian has the even smaller amount than other people. So obviously there is a cultural issue that goes with it. And what do you do if somebody comes to you? What would you do?
Yeah. Well,
how do you start the talk that it is bad for you?
Yeah.
And one way to do is they call 5A approach. First, you have to ask them, hey, do you smoke? So every time they come, I have to ask them, do you smoke? And then you can give advice how to quit smoking. And then you give ideas, if I give you some medication, what do you think? So you assess their readiness. Then assess them with the medication. There's few medication that you can give nowadays had a pretty good success rate, other than just nicotine patch or telling people quit smoking. Then arrange for a follow-up. You tell them, like any other disease, you tell them, come back next month or 2 months or 3 months, and I will just going to talk about the smoking, whether you are following through. Because reinforcement actually works. Depends on how much you take.
So also tell us a little bit about some of the resources which these patient can access and support group.
Support group is good,
Okay,
but this is a very addicting disease.
that's true.
It's very difficult to just tell people that just go and quit.
Yeah.
If that is the case, most of the people would have quit all this
Yeah.
time.
Yeah, that's true.
So 3 ways you can do. One is the nicotine replacement, and another is called there's the antidepressant called Wellbutrin,
Yeah.
and there's a trade name, and that also helps. You also can give a medicine called Chantix,
Can't
which works completely different than any other medication. And so it works on the brain, you decrease your craving, and actually it works.
Oh, it was.
Yes. And but anything you do is better than doing nothing.
Of course. Right.
If you tell people that, I used to smoke 20 cigarettes a day, now I do 10, he will get the benefit
Yeah.
of
course.
cutting down the smoking. It will cut down the risk for heart attack. It will cut down the risk of stroke, lung cancer. So why people have so much difficulty to quit smoking?
Yeah.
First of all, it goes to the withdrawal.
Withdrawal. So there.
It is a real withdrawal. And if you stop smoking today, after 3 days, and it may last for 3 to 4 weeks. And the craving for smoking may even last years.
Wow.
So it is not one shot, and when you stop smoking, you just don't say wonderful job, because you have to keep up with them and says how things are going.
Oh, wow.
So even after 6 months, you say, probably should think about not starting it,
Yeah,
because the failure rate is so high.
Yeah.
Somebody asking me how much you gain weight.
Yeah.
It is a real thing. You usually gain 4 to 5 kilogram, or approximately 10, 11 pounds in 6 months. If you compare what happens with the weight gain and the smoking, is that weight gain made him more at risk for heart attack or stroke? No. People who keep on smoking had more complication than people who quit smoking and gain weight. So even if you gain weight, it is better to continue to stop the smoking. Another thing people will say, I didn't cough this much since I stopped smoking. It is a very common question. And yes, it is not in their head. It is actually happens. And it happens pretty often. But good thing is that it will get better.
Good. So it does get better.
Yes, it will. It is not just, it will last for weeks or 2 weeks, 6 weeks, 10 weeks, but it will get better.
Good.
And they will start to breathe better, and there will be rate of bronchitis will go down. So it will be a good thing as a whole. Not only smoking, coughing, but heart attack, stroke, everything else, peripheral vascular disease. And you asked me about the modalities that you can do, or what medication you took.
Yeah.
And replacement therapy, you have patch and a gum and inhaler.
Okay.
All works. And trick is to that, you can take the patch and a gum at the same time.
Oh, good. I didn't know that.
Yeah, you can do that. The patch will give you continuous nicotine dose. When you are having urge, you chew the chunk.
Okay, so you chew.
Yeah, and you don't have to chew it completely. You just chip at the end so that you release nicotine little bit at a time.
Okay, so don't do all at once.
No. So you can do that multiple times, and people will understand that ultimately he will be able to do this. Every time you feel the urge, he will take another crack at it.
So, okay, so it can last then longer throughout, maybe longer time.
Yes, and he can do that all day long till he gets out of this habit of picking up a cigarette, and that will take a long time. And as you say, Wellbutrin or bupropion, it is good medication, and but you have to make sure that you don't have a seizures or something like that, other things that can complicate. And the Chantix or they call varenicline, which is a good medicine. People can use patch, varenicline together. There's a lot of studies done to see whether two works together or can be given together, or is it toxic. Some people say that if they want to smoke, let them smoke.
Oh, with those.
Yes,
Okay.
nicotine patch. They say that they'll smoke much less.
Much less.
And ultimately, goal is to get him off the cigarette, not the stop all of a sudden.
So sudden stop is hard.
It's very hard for
Very
those
hard.
people. They smoke for 20, 30 years. It's not going to happen.
Yeah.
That's why the failure rate is so high. Aim is to have a high success rate. So these are the strategies that you can take, and it will work.
Sure, that's amazing that there are simple tricks which we can do, and we want to make sure we educate. Number one, second is support group which Dr. Jamil outlined to make sure and then third is encouragement. So don't give up on these patients, and we have to keep reminding them that failure is actually a real thing, which means that a lot of people unfortunately do fail. But get back on that. Don't give up, and don't have a certain date. Sometimes it's hard, and so it's best is keep all, and you can use multiple modalities, and those are really good options. Certain side effects you should be careful with Wellbutrin. If you have seizures, with Chantix, make sure no suicidal ideation and some other side effects, which are especially they are into this binge shopping or eating or those behaviors, so that can happen. Third is if you unfortunately have drinking problem or other drug problem with it, then it has to be addressed too. And then there are psychological issues which are also important. So if you have anxiety disorder, depression, and you're using this as a means and ways to get out of that, then probably we need to address those with it. And fourth is always want to make sure that we encourage them to whatever steps they are successful. So if they cut down, like Dr. Jamil said, from 15 to 10 cigarettes, to us is a success. And yes, it will help your breathing. If you're worried about weight, yes, there will be a few pounds, but eventually the gain is far more than that. So pay attention to that. That will really help. So with those, would you like to then give us some final tips and summary?
At one point there was an issue whether we should be able to give Chantix to a depression patient.
Oh, yeah, that was it.
And they did a study, and they didn't find that it is that important. And actually, FDA has taken that contraindication from the list. So anybody can get Chantix or varenicline. And as you say, Wellbutrin have to worry about other issues. But a combination therapy is a right way to go. Important thing that somebody has to quit smoking at all cost.
That's true. And that's so important. So with those things in mind, I'll just wrap it up so it's very important that we pay attention not only to patients but also to colleagues. As I mentioned, there is a lot of incidence of smoking among medical profession, unfortunately, and we are making sure that we tell our colleagues and everybody that make sure you stop doing that. And also pay attention to kids. So a lot of my patients don't pay attention where they're smoking. They have small kids in that same room or next room, and they say, oh, we are smoking in next room. Well, there is a ventilation, and it can cross ventilate and cause a lot of ear infection, asthma, and lot of problem with respiratory. So pay attention. Also, there's a high incidence of sleep apnea, people who are smoker, not to mention COPD and heart disease and so forth. Dementia risk also goes up. And I always tell patients, if you think that it doesn't affect, why don't you take your blood pressure before smoking and 5-10 minutes or 15 minutes after you smoked and check your blood pressure. Your pulse will be higher, your blood pressure will go up, so you can see yourself what it's going to do to your body. So maybe that might help you to stop and think about your family, which secondhand smokers are worse, causing a lot of health issues in and what they unfortunately they did nothing but try to support you, and you can expose them to all kind of carcinogens and cardiac problem and so forth. So with those, any final thought, doctor?
You know, this addiction starts very young age. The younger you are to start the smoking, the longer it's going to last.
Oh, okay.
So, it's very important that the kids at the school should not take it, start it. They did a study to see how long it takes to be addicted to smoking. It takes 2 weeks for a ninth grade student. So a lot of people couldn't quit. Another thing that came to the market called Juuls.
Yep.
And vaporless and the things like
vaporless.
And so those are very addicting. What they did is that they changed the chemicals to the point that, when you smoke, your throat gets irritated. Juul doesn't.
Juul doesn't.
No, it takes some of the chemicals out of it so that you smoke, you don't feel bad and get addicted anyway. On the top, they changed the flavors, which is more appetizing, and also make the design looks like an Apple telephone, very slick.
Yeah.
And so that kids gets attached to it quickly.
Wow.
That's the
sad.
So you have to take care of the kids from the very beginning, because that's where you're going to start a lot of times.
So that's very important that we pay attention to these media wars with these companies. They don't think about health much. They just think about selling their products, unfortunately. Also, the vaping is under big attack because of a lot of lung problem which we are seeing. So I think if we adopt healthy habits and pay attention and tell kids to pay attention to those, that's gonna really help. Yeah, it's a team effort. Believe me, this is addiction. Any addiction is a team effort, and it needs a lot of encouragement from parents, family, friends, everybody, to make sure that we are doing our best. So with those things in mind, feel free to give us Twitter feedback, email, and some of the smoking. These help are on National NIH website. CDC has a great website. You can check out all our slides which are running. So give us feedback, and thank you, Dr. Jamil, for your kind time and devotion to this topic. And thank you, ladies and gentlemen. Good night.
Thank you.